hear the words with them spoken by someone who cares for them. To those children in whatever language, wherever you are, we must tell you, you matter. Your body matters. What you feel matters. You have the right to say no. You have the right to express yourself. This is what I want to tell you. As a conclusion, I must say, this is not a moment where we are releasing. This has to be a movement. Let this release not just end here. A good news, a story, something that everybody is, some photographs and some newspaper clippings. But let this be beginning of a movement, a sustained, systematic commitment to giving every child in institutional care in India the knowledge they need to stay safe and the skills, the language to name what happens to them and their bodies. Child protection is not complete when we rescue a child from harm. It is complete when the child grows up knowing their own worth. This is a world we are building today. And I must specifically congratulate the Enfold team for the kind of research and the kind of universality in the context in which it is written. It can be adapted in any language, in any system. And I think it has the fact that it is done with active involvement of children, professionals, and others, and making sure the children were part of it. And with courage, with consistency, and with the deepest love for children in our care, I must congratulate you for your work, Enfold team. All the very best. And I wish this becomes a reality in every state, in every CCI across the country. Congratulations and all the very best. Thank you.
Thank you very much, Sony sir, for your wonderful opening remarks. It has setting a tone for the today's release so beautifully. Thank you very much. Now we are officially moving into the release of our handbook. We have heard the importance of the handbook and how it has been contextualized for the children in various settings, especially in the CCI settings. So we will move to the official release of our handbook. Thank you all for joining us with us for the release of our handbooks. I will also share a link in chat box for the links of these books. The handbooks are available for the children and staff of a childcare institution. We have 2 handbooks in 2 languages, in English and Kannada. Please go through them. It's also available in our website. Please have a look and make use of the resources. Now we will be moving to the next segment of this webinar. We now move into the next segment of our program, a presentation on key findings related to the implementation of the program on life skills, personal safety and sexuality. I would like to invite my colleagues Vibha Angre and Siva to present these highlights. Ms. Vibha Angre is a legal professional and child rights practitioner, currently working as a program manager with the restorative practices team at Enfold. She holds BA LLB from Bangalore University and LLM LLM in Human Rights from Cardiff University, UK, with experience in immigration law in UK and a strong interest in child rights and legal research. She is committed to advancing issues of child autonomy and protection. Ms. Siva is a senior facilitator with Enfold, focusing on personal safety, gender, and sexuality education. She has been associated with Enfold starting as a freelancer and now as a part of the prevention team. Her work focuses on creating safe, inclusive spaces for children, young people to learn, reflect, and express themselves with confidence. Vaban Siva, over to you.
Thank you, Pavitra, for that kind introduction. I could just request you to please share your screen.
Give me a minute.
Thank you, everybody, for joining us today on this lovely morning. What we're going to be doing now is taking you through a few key features and the structure of the handbooks themselves. We also have a few snippets from the handbook. I do encourage that after this that you go through them in detail, but we'll just take you through it. And if you have any questions regarding them, please do put them in the chat box and one of us will respond to you as and when we see it. Thank you, Pavitra, for sharing. So over the past 3 years, the prevention team and the restorative practices team, with support from UNICEF Field Office for Karnataka and BOSCH CSR, have developed content for facilitating life skills, personal safety and sexuality education, and certain child rights laws as well, specifically for children and staff in childcare institutions. These handbooks are a reflection of 3 years of designing, testing, and implementing the program. The handbooks are available both in English and Kannada. The Facilitator Handbook for Children is designed to enable the delivery of life skills, personal safety, and sexuality education. Pavitra, if you could move to the next slide, please. Safety education and child rights law, and it's meant to be in a scientific way, rights-based manner, and empowering and child-friendly. What makes it unique is that it is contextualized specifically for children in need of care and protection between the ages of 14 to 18 residing in CCIs. The session creates intentional spaces for children to reflect on themselves, recognize their strengths, develop a deeper understanding of their bodies, and then begin to build the confidence to assert their rights and autonomy in safe, informed, and respectful ways. We then also have the Facilitator Handbook for staff that focuses on staff to better understand the adolescents, the changes they go through, how to communicate life skills and personal safety and education to children in a child-friendly, scientific, and rights-based manner. The handbook is designed to take facilitators on a reflective journey with staff. Staff are invited to revisit their own experiences of adolescence, bringing them to the present, where they now explore how they would now respond to children given this current awareness and sensitivity. It also helps in building practical tools for staff to engage with children more confidently about these topics. We once heard from a staff member who told us she would shy away from answering any questions about sex and sexuality. But after the sessions, she was so comfortable that she wouldn't even answer them in the corridors of the CCI. Next slide, please. Next. While providing casework support, the restorative circles in CCIs, the need for personal safety and sexuality education emerged strongly from staff and children themselves. When we look at the Juvenile Justice Care and Protection Act, as well as the JJ model rules, we see that there is a right of children in CCIs to live with dignity, access to care, protection, development, and social reintegration through a child-friendly approach. We also see in Section 53 that life skill education is a key component of rehabilitation services. It's important to note, like Mr. Sonykutty George also stated, that children in need of care and protection come from deprived backgrounds, often with limited guidance on personal safety, gender, and sexuality. This, combined with low self-worth, limited social skills, can further increase their vulnerability. The handbooks aim to further these goals of the JJ Act, particularly in the context of gender equity, personal safety, and sexuality education. Now, who can use these handbooks? These handbooks can be used by CSOs, individuals working with childcare institutions, and even staff of childcare institutions themselves. Individuals with prior training in personal safety and comprehensive sexuality education are preferred as the effectiveness of the sessions actually depends on the facilitator being at ease with their own sexuality and the ability to be open-minded, non-judgmental, and competent to facilitate these conversations on sex and sexuality with children and adults from diverse backgrounds. These are also can be used to ensure that there's uniformity in the content and facilitation across different individuals. We also see that, we also want to look at how the content of this was developed. Now, as mentioned earlier, the content has been developed over the past few years. The initial stages do from the prevention team's work within schools when they were facilitating these sessions on life skills, personal safety, and sexuality, together with the restorative practices teams that worked in childcare institutions. Therefore, they came together and contextualized this to CCI settings to suit the lived realities of children and staff therein. What really helped firm up the content was the needs assessment that was conducted before each pilot program was implemented in a CCI, and post-test to understand the shift and assess the effectiveness of the session. These inputs helped refine and strengthen the content for greater impact. Additionally, the teams have been undergoing sensitization discussion, post-program debriefs, and feedback from participants that have been incorporated and have helped in improving the content. When we look at the content testing, like we said, that it has been tested across, and we've done many pilot programs. Next slide, please, Pavitra. The contents of these handbook have been tested in Kannada and Hindi across 8 CCIs and 1 aftercare facility. A total of 11 programs were conducted for children and 8 for staff, reaching 125 girls, 86 boys, and 81 staff members. We also tested the content in 5 CCIs in Bangalore Urban, 2 in Belagavi, and 2 in Bellary. This we did to understand how it can be contextualized for different districts in Karnataka. The efficacy of the content has been assessed through post-test, pre-test, and also a few focus group discussions. I would now like to take you through a few key features of the handbook. So I've stated that these handbooks have been specifically designed for children and staff in CCIs, particularly for children in need of care and protection. The focus of the topics are on life skills, personal safety, sexuality education, gender sensitivity, and legal awareness on related topics. We also see that it has been developed through field experiences of both teams, whether in schools and in CCIs, pilot testing it, and also integrating the self-identified needs of children and staff. The sessions follows a participatory and experiential learning pedagogy. This has been made possible through the inclusion of restorative processes and restorative practices. This enables a holistic integration of life skills and restorative approaches that helps build a safe and positive and supportive space for both children and staff. We'd also like to take you through briefly the sessions that are covered in the handbooks. Next slide, please. It is on our multiple intelligences and qualities, self-esteem and body image, goal setting and achieving goals, sexual development in adolescence, pubertal changes, understanding sexuality with responsibility, respect, and support, gender sensitivity and gender equity, personal safety education, and relevant laws such as the POCSO Act and the Prohibition of Child Marriage Act. Next slide, please. I would now like to speak to the structure of the handbook. Each session is thoughtfully designed to support the facilitator with clear guidance and flow. Next slide. We have the learning objectives. The learning objectives now clearly outline what the objective of the session is, what it intends to achieve, and the key areas that they aim to explore. The learning objective of each session is given at the beginning of the session. This helps provide an overview of what it contains. I request everyone to continue to look at the right side of the screen to see snippets of how they appear in the handbook. Key messages. Next slide, please. Key messages in a session plan refers to the core idea, the insights, or the takeaways that the facilitator intends for the participants to understand, reflect, and then carry forward in the session. They help anchor the session's purpose, ensuring activities, discussions, and reflections are all aligned with what actually matters. Now, they're not just information that's to be delivered. They are themes that participants engage with throughout the session. Next slide. We also have key concepts that we have put down in the handbooks. Now, key concepts are the central ideas, the terms, or the frameworks that the facilitator and the participants need to understand in order to engage meaningfully with the session. The key they found the foundation of the topic. In a session, they have the key concepts are placed at the beginning of the session. They also have descriptive visuals that help support and deepen the understanding. For a facilitator, it is encouraged that these key concepts are understood prior to the session so that it can be facilitated in the method and the manner that the intention of the session is. Next slide, please. We also now have the session plan. So the session has been designed in such a way that it is 90 minutes for children and 120 minutes for staff. The session plan is a detailed session plan which gives you step-by-step description from opening of the session to the prompts that need to be asked, the activities that have to be facilitated, and then how to even close the session. This is presented in a clear and descriptive manner and helps the facilitator navigate from one aspect to the next. We also have the inclusion of restorative elements. The restorative elements is a unique feature of the handbooks. It helps in the participatory and experiential learning of this process and the program. Each restorative element has been thoughtfully designed to align with the session. So it has the openings, it has community building questions, closings, as well as the co-creation of values and guidelines. The session plan also has QR codes that the facilitator can use that, would take them to videos that can be used for openings and closing, videos that can be played at activities, and also suggested values that can be brought in that can help the conversation and reflective questions that can deepen the engagement. We also have specific activities or handouts. Next slide, please. Such as worksheets on multiple intelligences and qualities, the goal wheel and the smart codes. They have been thoughtfully designed and translated for the use of the session. These have been carefully selected and designed in a manner that children and staff of CCIs can participate in. So they're simple to facilitate and equally easy to participate in. Each handout is also accompanied with a detailed description of how to facilitate it, along with reflective questions to guide the discussion during and after the activity. We also have in the handbook something that we say as affirmations. Now, affirmations in a session, next slide, please, are intentional statements or expressions that recognize and acknowledge the participants' strengths, efforts, and qualities. So in a session plan, when you look at it, we do have affirmations that we would say as facilitators, and then also invite and encourage participants to repeat it. This creates a sense of being seen, valued, and also appreciated within the group. Over time, what it can help is of the way of building trust, confidence, and a positive group environment. They also help participants recognize their own strengths, fostering self-worth and deepen a sense of belonging. Another thing that we have included, so as we stated that these handbooks have been developed pilot testing, what we've also done has been a lot of learnings for us as facilitators. So we have incorporated them into the handbooks as facilitator tips. They include do's and don'ts for facilitators, along with notes and practical tips for effective facilitation. They are drawn from field experiences. They offer guidance on navigating sensitive conversation, responding to participants with care and empathy, and adapting sessions to the needs and the dynamics of the group. They also help facilitators maintain a safe, respectful, inclusive space while staying grounded in a trauma-informed and non-judgmental approach. They are woven throughout the session and are also provided as a detailed list in the annexure of the handbooks. And finally, another part of the structure are the pre-test and the post-test questionnaire. As stated, all of this has been developed through need assessment, pre-test and post-test to look at the efficacy of the sessions, which then help facilitators tweak it or fine-tune it the next time they go in. So we have designed certain pre-test and post-test questionnaires and including feedback questions that have been placed in the annexure of the book. And we have ensured that what we've tried to do is we've paid very careful attention to the wording and the language to ensure there's clarity and relevance, and also so that it suits the needs of children in CCIs. As we know, most of the children in certain childcare institutions haven't attended school. So this is also keeping in mind the different literacy levels. I would like to point out here that all of this has been translated into Kannada, so that it's also easy to use for a facilitator who would be facilitating these conversations in Kannada. and also for staff of CCIs who would like to facilitate for children to go through it. I would now like to hand over the presentation to my colleague Siva, who would take us through the additional contents of the handbooks and conclude. Thank you.
Siva, you are on mute.
Yeah. Can you all hear me? Hi, everyone. Vibhav, thanks once again for articulating the need for the handbook and what the handbook contains, the key messages, the key concepts, and the entire session plan, everything in a structure. But I'm going to also take you now into what it actually feels like to be in a session and actually see a real shift happen during the session. So for that, we realized very early that in children in CCIs don't need any more lectures. They need a space where they can experience, speak, reflect. So the handbook is designed in such a way that the sessions don't feel like it's teaching happening. They feel like conversations, activities, and sometimes there's a lot of fun and play. And this handbook, right now it might be limited to pages, but it is actually opening space to add more creativity, stories, life experiences after each program, after each use of this handbook. So, can you move to the first slide? So I'll just talk about various elements which make it very interactive. The first is the case studies. We have put the few case studies from the handbook out here to see how it is described. But case studies is a way we bring in a situation that brings something real, something real. Instead of just telling children, this is right, this is wrong, we are making children, basically children are thinking, what is it happening here? What would I do? Or what would one do? And suddenly the room's opening up. People are talking. There's no pressure to give a right or a wrong answer, but just discuss. And the case studies have no real names or real places. They are scenarios. The next set of activities we have are role plays and group discussion. So when it comes to role plays, it is one of the most powerful tools. So they actually, instead of just saying one needs to set boundary and so on, is how does it actually feel to say no? Actually, to set a boundary can be obvious through a role play. But here we have actually seen children who are hesitant, they don't get up at all. And then slowly they hesitate, laugh, feel awkward, and then they slowly get into the role and they enact the role and they are completely into it. So it also is fun. The group discussions actually make children feel, yeah, this space is safe and I'm not the only one thinking like this. So there is again a community building solidarity happening there in group discussions. The next one is reflections. While reflections are kind of the energy level drops in these sessions because there is a lot of inward thinking. There's a lot of self-awareness getting built. Participants are connecting to the topic, to their own life. So these are quieter moments. Questions like, what do I feel about this? What does it mean to me? How do I treat people? How am I being treated? So these are some of the things. How am I responding? Am I responding instead of reacting? And am I succumbing to peer pressure or unsafe situation? All kinds of thoughts and reflections happen here. For in staff sessions, this is the place where the staff understand the emotions that affect children, such as shame, curiosity, peer pressure, silence, confusion about boundaries, and how are these children responding to discussions on body, gender, and safety. In the scenario-based learning, this is kind of a preparation for real-life situations. If this actually happens to me, what would I do? So it's not just understanding, it's also kind of a preparation, kind of being more self-aware. So we have moments where there is abrupt quietness, reflection, then comes the games and the energizers. Okay. Can you move to the next slide, please? Yeah. So this is a most, it's very small, but it changes everything. So on the day one, these energizers and the games are the ones which actually break chunks of ice and we all get are set free. Basically, no stiffness, no hesitation, and a lot of comfort between the participants and the facilitator. Especially in CCI, trust is something, a premium. It's not coming automatically to us. So these energizers and games actually help a lot. So once people start laughing, they also start opening up, and then the games, it's all completely body and mind, working together. So after the day one, everyone looks forward to these moments in the session. Next slide, please. Yeah. So, this was about the games and energizers. And again, there is a lot of creativity out there. So basically, if you actually sum it up, what we are doing is very, very simple. It's not teaching, it's learning together, and learning together with a lot of dignity and a lot of real engagement, which is happening. So I'll just conclude that these handbooks are not just about sessions, content, messages. We are actually creating spaces where children are feeling free to speak, staff are feeling confident to respond. And this is brought together with life skills and restorative practices, which is practical and grounded. And all the handbook entirely reflects years of learning and commitment to ensure children and staff feel supported, informed, and respected. So I hope this handbook really connects children and staff and the teachers together. Thank you. Hey, Pavitra, over to you.
Thank you, Siva and Vibha, for the informative presentation highlighting the whole program and the PPT and explaining how it is helpful in the CCI settings for the children and staff. And we now transition to our first panel discussion on experience of the program. The panel discussion will be followed by an open house session and will be moderated by Ms. Pushpalata M. I will take a moment to briefly introduce our moderator and each of our panelists. Our moderator, Ms. Pushpalata, is a development professional. 2 decades of experience working with children, youth, women, and families to promote social change. She holds a master's degree in sociology. Her work focuses on child rights, gender equity, and personal safety education. She currently serves as Director, Prevention Programs at Enfold and strongly believes in the power of education and awareness to transform the lives. Welcome, Pushpalata. Joining Pushpalata, we have with us Krishna Pujari. Krishna Pujari is a student from the Children Home for Boys, Belagavi. He is currently pursuing second PUC. He has actively participated in life skill and personal development programs and bring valuable youth perspective to discussion. Welcome, Krishna. We also have Mr. Venkatesh. Mr. Venkatesh has completed his Master of Social Work from Tumkur University in 2012. He has been working at the government boys.
Lata, maybe you can also ask that in Kannada.
ಇಷ್ಟವರೆಗೂ ನೀವು ಥ್ಯಾಂಕ್ ಯು ಅಲಿನ್ ಫಾರ್ ರಿಮೈಂಡಿಂಗ್ ಮಿ ದಟ್ ಇಷ್ಟವರೆಗೂ ನೀವು ನಮ್ಮ ಚೈಲ್ಡ್ ಕೇರ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸ್ ಅಲ್ಲಿ ಇದ್ದಂತಹ ಯುವಕರು ಮತ್ತೆ ಅಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಸಿಬ್ಬಂದಿಗಳು ಎನ್ಫೋಲ್ಡ್ ಅಧಿವೇಶನದಲ್ಲಿ ಭಾಗವಹಿಸಿದ ನಂತರ ಅವರಲ್ಲಿ ಆಗಿದಂತಹ ಬದಲಾವಣೆಗಳು, ಅವರ ಒಂದು ದೃಷ್ಟಿಕೋನದಲ್ಲಿ ಆಗಿದಂತಹ ಬದಲಾವಣೆಗಳು ಮತ್ತು ಅವರ ಎದುರಿಸಿದಂತಹ ಕೆಲವು ಸವಾಲುಗಳನ್ನು ಹಂಚ್ಕೊಂಡಿದ್ದಾರೆ. ಇದ್ರ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಏನಾದ್ರೂ ಪ್ರಶ್ನೆಗಳಿದ್ರೆ ದಯವಿಟ್ಟು ಅದನ್ನ ಕೇಳ್ಬೋದು ನೀವಿಲ್ಲಿ, ಅಥವಾ ನೀವು ಚಾಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಕೂಡ ನಿಮ್ಮ ಪ್ರಶ್ನೆಗಳನ್ನ ಹಾಕ್ಬೋದು. ನಾವು ಅದಕ್ಕೆ ಉತ್ತರ ಕೊಡುವಂತಹ ಪ್ರಯತ್ನವನ್ನ ಮಾಡ್ತೇವೆ. Pavitra, are there any questions from the audience in the chat box?
No questions in the chat box.
Okay. So I think we can close this panel discussion. What we heard today reminds us that the life skills, personal safety, and sexuality education are not optional additions. They're essential for dignity, confidence, and protection. Children need safe spaces to talk with, ask questions, without any fear. I think the circles that has created a space for them to speak from their heart. One of the panelists also mentioned, I like the word Hrudayadinda Matanadi. ನಿಮ್ಮ ಮನಸ್ಸಿಂದ ಮಾತಾಡಿ, speak from your heart, which stayed in his mind, and I hope he's practicing it that also. And children caregivers also need support to respond without any discomfort, and that's the reason this session was like more focused on the reflective learning process. I hope that has helped the staff also to speak to children without any discomfort. And institutions also need systems that make this possible consistently. These books are one step in that direction, but the real work happens in everyday conversations and relationships and trust building. Thank you all for helping us understand that so powerfully today. And I have one special announcement here. Let's be honest, conversations around gender, sexuality, and child safety are often avoided or shut down. This silence can leave young people confused or misinformed or even unsafe. So we asked, what if there is a space where no question felt too awkward or wrong to ask? That's why we created this chatbot. Enfold has created a chatbot for adolescents and adults who access accurate science-based information in a safe, non-judgmental way. It's a space where curiosity is respected, questions are answered, and young people don't have to navigate these topics alone. The bot is in our website, and soon it will be on WhatsApp. Please use, share, and spread the word. ನಾವು ಎನ್ಫೋಲ್ಡ್ನಲ್ಲಿ ಈ ಸೆಕ್ಷುಯಾಲಿಟಿ, ಪರ್ಸನಲ್ ಸೇಫ್ಟಿ ಮತ್ತು ಜೆಂಡರ್ ಈ ವಿಚಾರವಾಗಿ ಮಾತನಾಡಿಕೆ ಸ್ವಲ್ಪ ನಮಗೆ ಮುಜುಗರ, ಹಿಂಜರಿಕೆ ಎಲ್ಲ ಇರುತ್ತೆ. ಹಾಗಾಗಿ ಮಕ್ಕಳಿಗೂ ಸಹ ಯಾರು ನಾವು ಹದಿಹರೆಯದವರು ಅಂತ ಹೇಳ್ತೀವಿ, ಅವ್ರಿಗೆ ಇರ್ತಕ್ಕಂಥ ಈ ಸೆಕ್ಷುಯಾಲಿಟಿ, ಜೆಂಡರ್ ಮತ್ತೆ ಪರ್ಸನಲ್ ಸೇಫ್ಟಿ ಬಗ್ಗೆ ಏನೇ ಕ್ವೆಶನ್ಸ್ ಇರ್ಬೋದು, ಅದನ್ನ ಮುಕ್ತವಾಗಿ ಹಂಚ್ಕೊಳ್ಳಕ್ಕೆ ಒಂದು ಚಾಟ್ ಬಾಟ್ ಅನ್ನ ನಾವು ಕ್ರಿಯೇಟ್ ಮಾಡಿದೀವಿ ಎನ್ಫೋಲ್ಡ್ ಕಡೆಯಿಂದ. ಅದು ಈಗ ಆಲ್ರೆಡಿ ನಮ್ಮ ವೆಬ್ಸೈಟ್ ನಲ್ಲಿ ಅವೈಲೇಬಲ್ ಇದೆ. ವಾಟ್ಸಪ್ ಅಲ್ಲಿ ಕೂಡ ಅದನ್ನ ನಾವು ಕಳಿಸ್ಕೊಡ್ತೇವೆ. ಯಾವ ಒಂದು ಮುಜುಗರ ಇಲ್ಲದೆ ಒಂದು ಸೇಫ್ ಸ್ಪೇಸ್ ಆಗಿರುತ್ತೆ ಇದು. ಅದರಲ್ಲಿ ನೀವು ಅದರ ಉಪಯೋಗನ ನೀವು ಪಡ್ಕೋಬಹುದು ಅಂತ ಹೇಳ್ತಾ ಐ ಲೈನ್ ಮೈ ಟಾಕ್ ಹಿಯರ್. Thank you everybody.
Lata, we have also shared the link to the chatbot in the messages.
ಚಾಟ್ಬಾಟ್ ಅಲ್ಲಿ ಇನ್ ಚಾಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಈ ಒಂದು ಚಾಟ್ಬಾಟ್ ಲಿಂಕ್ ಅನ್ನ ನಾವು ಹಾಕಿದೀವಿ, ಅದನ್ನ ನೀವು ಉಪಯೋಗಿಸಬಹುದು. Thank you.
Thanks, Lata. Thank you to our all panelists for such rich and engaging discussion, and a special thanks to our moderator, Ms. Pushpalata, for guiding us to conversations so thoughtfully. So now we have a recorded video message regarding the program and the handbook from Ms. Shilpa Dioda, who is from BOSCH-BGSW CSR. So I'll introduce ma'am also. She's unable to join today, so she has sent a video recorded message. Ms. Shilpa Dioda leads CSR strategy and initiatives at BOSCH Global Software Technologies. With over 24 years of experience in HR and CSR, she has played a key role in advancing volunteering, social leadership, and impactful programs across such as education, disability, environment, and community development. She holds an MBA and brings deep expertise in driving social change through strategic CSR initiatives. I now invite my colleague Vibha to share the video message.
For over a decade, BOSCH Global Software Technologies has been supporting child protection efforts in Karnataka, contributing to education, health, and overall well-being for vulnerable children, including those in childcare institutions under the Juvenile Justice Act. As family-based care begins to take stronger shape, we see a clear opportunity to further strengthen how we support children and their caregivers within institutional care systems. Today, we are proud to mark an important milestone: our partnership with Enfold Proactive Health Trust to co-create a handbook for child protection, ecosystem, children in need of care and protection, and those in conflict with the law who face unique vulnerabilities, caregivers and staff play a critical role in their rehabilitation and reintegration. And with the right tools and structured guidance, their impact can be significantly strengthened. This is why programs on life skills, personal safety, and sexuality education are so important. They help children build confidence, understand boundaries, and become aware of their rights, while enabling caregivers to respond with empathy, clarity, and consistency. Through our collaboration with Enfold, we have reached children and caregivers directly through pilot interventions in Bengaluru, strengthening on-ground learning and engagement. We have built system capacity through training of 117 facilitators, including government CCI staff and NGO practitioners working inside institutions. We enable scale through restorative care practices now institutionalized across childcare institutions in Karnataka, creating a self-sustaining model. We have extended impact across 25 districts in Karnataka, embedding consistent child-focused practices within the system. Today, we launched the Handbook on Life Skills, Personal Safety, and Sexuality Education. This resource enables structured, sensitive, and legally aligned engagement in childcare institutions, helping children understand their rights under laws such as the POCSO Act and the Prohibition of Child Marriage Act, while equipping staff with clear practical guidance. Its impact is designed at multiple levels. For children, strengthening confidence, awareness, and self-protection. For staff, enhancing capability. For sensitive and effective facilitation. For institutions, enabling standardized and scalable practice. For the system, improving child-centric decision-making. Our partnership with Enfold reflects a shared commitment to creating solutions that are practical, relevant, and scalable that can be embedded meaningfully within the system. As we launch this handbook today, we reaffirm our commitment to strengthening child protection systems with clarity, compassion, and accountability. We invite government bodies, NGOs, and community partners to adopt and amplify this resource so that every child grows up with dignity, safety, and opportunity, and so that these practices become a consistent standard across the state. At Bosch Global Software Technologies, we believe lasting change happens when systems are strengthened, people are empowered, and solutions are designed to endure. This handbook is a step toward a child protection ecosystem where dignity is non-negotiable, rights are upheld, and every child has a chance to thrive. And this is the purpose with which we continue to be here to serve.
Thank you, Vibha, for sharing the message. On behalf of Enfold, I thank Ms. Shilpa Diodar ma'am for her wonderful message about the program and the handbooks. Now I invite my colleague Kavita to introduce the next panel for the panel discussion.
Thank you, Pavitra. So now we move into our second panel discussion, which will focus on empowering children, scaling life skills and personal safety in institutions. This session will be moderated by Ms. Arlene Manoharan. Joining her on the panel today are Dr. Sneha C.V., Mr. Sonykutty George, and Ms. Urvashi Tilak. I'll take a moment to briefly introduce our moderator and each one of the panelists. Ms. Arlene Manoharan is a trained social worker with over 3 decades of experience in child protection and juvenile justice. She holds a master's in social work from TIS, Mumbai, and has worked extensively with civil society organizations and Center for Child and the Law at NLSIU, where she led the Juvenile Justice Program. A national level trainer and advisor on child rights, she currently works as an independent child protection specialist and is co-founder of the restorative practices team at Enfold. We are privileged to have in our midst Dr. Sneha C.V. IAS, Directorate of Child Protection, Government of Karnataka. Dr. Sneha is a civil servant with a medical background from Mysore Medical College. She has held key administrative roles across Karnataka, including Assistant Commissioner, Additional Deputy Commissioner, Additional Commissioner in the Excise Department, and has contributed to major projects at the Nadaprabhu Kempegowda Authority. She currently serves as Director of the Directorate of Child Protection, working to ensure the safety, rights, and holistic development of children, and is known for her strong administrative skills and commitment to public service. We are also very happy to have Mr. Sonykutty George with us today. I will introduce him again for those of you who joined later. Mr. Sonykutty George is a child protection specialist at UNICEF with extensive experience in child protection and humanitarian work. He holds a bachelor's degree in law from AMP Law College, Rajkot, Gujarat, and a master's degree in social work from Rajgiri College, Kerala. He brings strong expertise in international development, non-profit work, and program implementation. He has been actively contributing to initiatives focused on the protection and well-being of children. We are also pleased to have with us Ms. Urvashi Tilak, who has over 15 years of experience in women and child rights and currently serves as Senior Director at Counsel to Secure Justice, CSJ. She works closely with children in conflict with the law, leading restorative processes and advocating for systems change. She is also actively involved in capacity building initiatives and collaborates with government bodies, judiciary members, and other stakeholders to strengthen child protection and access to justice. Over to you, Arlene, for the panel discussion.
Thank you so much, Kavita. And I'd like to, good afternoon, Dr. Sneha. It's indeed a privilege to have you with us, Sony, and dear friend and colleague, Urvashi. And good afternoon to everyone attending this panel too, this webinar, sorry. It's indeed a privilege for me to moderate this important conversation on empowering children, scaling life skills, and personal safety in institutions. India's child protection laws, including the JJ Act, are grounded in the promise of care, protection, development, rehabilitation, and reintegration. I think all of us on this webinar are well aware of that. And childcare institutions, or CCIs for short, play an important role in this ecosystem by providing children in difficult situations with safety, stability, and support during critical periods of their lives. However, for children in CCIs, meaningful care and protection must go beyond meeting immediate and basic needs. It must also mean preparing children to navigate the world with confidence, with dignity, and the ability to make informed decisions, to recognize harm, seek support, and exercise their rights with confidence. And here is where life skills, personal safety, and sexuality education become essential. I think we've heard this from almost everyone who's been on the panels so far. And as Lata said, these are not additional components of care, but central to helping children living in these custodial institutions to build agency, to strengthen their decision-making skills, to understand the concept of boundary and know that they have a right to maintain those boundaries and tell people when they're violating them, and also to develop the confidence to speak up, ask difficult questions, ask sensitive questions, seek help from caring, trusted adults, and more importantly, help when they need it. Today's discussion is an important opportunity for us to reflect together and explore possibilities of working more collaboratively to develop and strengthen a culture of child-centered care and protection within these CCIs. One that also recognizes children as rights holders with agency, but also supported by a system, whether it's an NGO-run CCI or a government-run CCI, a system that ensures these kinds of knowledge resources are used. These kinds of programs are offered to every child that walks in to the doors of those institutions. And some critical questions that we must reflect on are, what does meaningful empowerment of adolescents look like in institutional care? How do we ensure that every child has the ability to stay safe, including within these very CCIs itself, for them to speak up and to reintegrate into the community with confidence and to thrive? What does it take to scale up life skills and personal safety education in ways that are consistent, inclusive, and sustainable? We are joined by a diverse panel bringing perspectives from government, from practice, and from UNICEF. I invite all of us to engage openly and practically as we think together about how to strengthen these efforts for every child in care. With that, let's begin to listening to our three panelists. So I'm going to start with, ma'am, to you, Dr. Sneha. Perhaps my first question would be, how embedded are life skills, personal safety, and sexuality education in institutional care for children in India? And can you share any information you may have of any such programs being conducted for children in CCIs anywhere else in India? And after that, Soni and Urvashi, you two could pop in, please. Yeah.
Good morning, everyone. First of all, I would like to appreciate Enfold for coming up with a new idea. It's exactly not a new idea, but a new initiative. What I want to say is this has been in the knowledge of everyone over the years. Everyone knows that children should be trained in life skills. They should know about the sexuality. They should know about safe sex. They should know about their own body. They should know about good touch and bad touch. Everyone knows that. But we are not able to come up with that because of some of the hindrances in our own culture and also some of the hindrances in our own self. We as an elderly people, we are not able to talk about sex or our own body, about or about any safe sex or safe touch. We are not able to talk about that. Maybe the way we are brought up or the way the society sees us when we talk like that. Maybe the hindrances we have. In childcare institutions, primarily we have children who need our special care and attention. They have been gone through many unhealthy events over their life. They may have single parent, they may not have parents also, and they might have passed through some abuse. They might be in some other like child labor, beggary. All these children are brought to our childcare institutions. So childcare institutions should work as a comprehensive unit to develop the children, not only for educational purposes, vocational purposes, but also majorly life skills. Their safety, their personal safety, their sexuality, their mental development, social and emotional development. Basically, first what we do is when the children come to childcare institutions, whether it is government or NGO, we will give them all the basic facilities, food, educate. We even give them education, vocational training whenever is needed. But somewhere we fail to look into this aspect, which has been beautifully brought up by Enfold now. And I would very much appreciate that. Maybe Karnataka is one of the first or maybe few states who is trying to bring it up in CCIs. Maybe other states, I am sorry to say, they may be little back in their thinking or mindset. How could we talk about this? How could we openly talk? We can't even train our staff in that. Leave alone the children. First, we have to train our staff. We have to be open-minded. Then they have to train our children. First, basically, our children should know what is mainly especially 14 to 18 years of children. They will always be confused. When they are confused, they will go to other sources of information, maybe internet, maybe some friend. They may not give a correct information. So best thing is give knowledge to children by ourselves. We should make them know what is our body. Maybe they will be like all the 14 years, maybe 12 years and above, they are ready for puberty. They will have secondary sexual changes. They have their body changes. We should first give the knowledge to the children that these are the changes you may face in next few years, and this is absolutely normal. And they will have some hormonal changes also. We have to counsel them before, give knowledge to them before, so that they feel that this whatever they are going through is absolutely normal. Then we will train them about the good touch, bad touch, so that whatever they experience, they feel that yes, this is what I have been experiencing over years, and this is not abnormal or nothing of my fault. Many times what happens as myself as a child or my friends as a children, whenever we used to face any bad touching, maybe public transport or anything, we used to feel bad about ourselves because we did not have knowledge. Like this is happening. We have to raise our voice. This is something bad happening to us, and that is the person who is doing is abusing us, and we have to raise our voice. We did not know that. Maybe that lack of knowledge, what made us to feel bad about our own self. Maybe we have certain changes in the body, which is making these people to behave like that towards us. So getting or giving all this knowledge in CCI is an absolute need of the time. And also we have to train our children to feel that this is absolutely normal. And somebody is trying to abuse you, you have to raise your voice. We have to give a perfect conducive environment for our children to come up. Like sometimes they may feel abuse, maybe through some elderly person, where when they are out for education, while public transport, or anyways, maybe sometimes inside the CCA also, through their peers or something. We don't know. So we have to train, we have to give knowledge and everything. And right now, what I accept is we are not completely into that. We have started, we are trained to do all the IEC activities. We have started with our good touch, bad touch, and everything. We have started training in the CCIs about all these things. We have started our kids to come out with that. And this, of course, this plan of Enfold, this scheme of Enfold has been very much useful. And whatever you have booklet, they have come up with that. It's completely comprehensive and it will be very useful in this process. Thank you
so much, ma'am. Really happy to hear your words and the importance of these handbooks and these programs. And really proud of being in Karnataka and the support that your directorate has given us to enable us to conduct these programs. So thank you so much, ma'am. So may I ask, Soni, would you like to go next? Have you heard of any of these programs being conducted anywhere in India? Just a minute, and then after that to Urvashi.
Yeah. Thank you, Arlene. I think I must say that with my knowledge across the country, there is no focused intervention as is being developed by Enfold as of now. But for the last 5 years, there have been interventions off and on personal safety, life skill education, and but not specifically centered around childcare institutions, but about adolescents, both boys and girls, and materials have been developed, handbooks have been developed. Andhra has done it. We have done some work in Telangana, some work in Assam, some work in Maharashtra. But it is the first time that a comprehensive work has happened. Even in Karnataka, we've worked with caregivers in terms of their mental health, trying to understand the challenges. But I think this is a very holistic approach and a very systematic approach, and that makes it stand apart. We worked with Andhra Pradesh AIMS Mangalgiri to develop some materials, chatbots to address these issues with residential in KGBVS and with a similar kind of materials, but not adequate support for caregivers to roll out this kind of a program. And I think that way this intervention stands out as a unique one across the country. Over. Thank you.
Thank you so much. Urvashi? Yeah.
Thanks so much, Arlene. Firstly, I think congratulations to Enfold on the release of this handbook. And as ma'am and Soni just mentioned, this is a very unique handbook, and it filled the gap, which was definitely there. Very comprehensive indeed, and very thorough. Having said that, and I agree to Soni what he was mentioning, that there are these sporadic activities which you hear of in some places, and some institutions and some organizations are doing that. But at the same time, they have not been sustained for a longer period of time. And some efforts are being made. For example, perhaps in Maharashtra, I think ASEAN is trying to do that in some places. But again, for us also, it was a challenge because initially we started off, and then again, there has been a break. So I think in some of the CCIs, life skills, perhaps that is something which is focused on. Vocational training is something which is focused on across CCIs. But on sexuality, it's a subject which nobody wants to speak about very openly. It comes with a lot of shame and stigma, and like ma'am said, that there is that gap where there is a change in mind shift which is required before we even have those conversations. So I think that gap is definitely filled by Enfold Sandbox. So yeah, over to you, Anne.
Thank you so much, Urvashi. I'll move on to our next question that I have for you. So in a couple of sentences, what is the biggest gap or challenge today in preparing children in these CCIs for independent living within the community, equipped with the knowledge and skills to navigate such issues of personal safety, gender equity, and sexuality? Ma'am, I'd start with you first again, and then Urvashi and Soni. So about a minute each, please. Thank you.
The major challenge, what I feel, is ourselves. The first thing is we should accept that, and how we will train our staff to communicate that to children openly. That is the biggest challenge. How we will speak to children, how we will train our staff, how our staff will openly communicate with their children, not in a very safe, conducive way, not in a like some unhealthy. It should not come out as some vulgar or explicitly something like abusing them. It should come out in a very safe, comfortable, healthy way. We should communicate it to children. That is the biggest challenge, what I feel is. Second thing is how our children will accept, how they will take that. They should not take it in some other way. That is how we communicate it to our children, how they will take that, how the knowledge will be imbibed to the children, the structure we develop, the curriculum we develop, how we focus. That is the biggest challenge. Once we go through that, I think acceptance will come. It is a process. Nothing will take like in today we will do that, children will accept tomorrow, or our staff will accept tomorrow. No, it is a very gradual process. We have to change the entire mentality of the society. It's a gradual process, but we should start the initiative in a very comfortable way. That is the biggest challenge I feel.
Thank you, ma'am. I hear you underscoring the fact that we adults are the biggest challenge. So, and the methodology and our attitudes and the skills of how we can talk in a comfortable way with these children absolutely underscore that. Yes. Urvashi, would you like to go next?
Yes. Thanks, Arlene. Resonate with what ma'am had said. And I think adding to that, based on our experience, I think one thing, I think even which was presented in initially by Vibha, that the Juvenile Justice Act talks about having life skills. Section 53 specifically talks about that. But we focus on these issues with the idea that perhaps when children come into the system or they are into the CCIs, they should automatically have knowledge of what they have done wrong or what has gone amiss. Nobody has a conversation with them. In some of the CCIs, the entire routine is actually missing. So I think what is required is that these activities have to be part of the routine. These have to be part of the program in the CCIs. So there has to be an incremental process over firstly making sure that the staff is trained, then ensuring that there is a curriculum which the staff is able to follow and have those conversations with children on different themes, because right now that what is missing, because again these are, and they surprise us with their interventions, with their thinking which they have, the questions they have, and we we don't provide them that safe space where it's okay to ask those questions. So firstly, are we providing those spaces in the institutions to begin with? And if there are no spaces, then these conversations will always be hidden, and children will not have a safe place to even raise these concerns. And then they resort to measures which are, perhaps just peer learning it through their peers who are equally ill-informed. So I think it's also very institutionally one has to set it up to make sure that children receive these, conversations, and these conversations become part of the normal and not something which is, which should be frowned upon. Thanks.
Yeah, I think the first challenge, as already mentioned, is the adult themselves or the caregivers themselves. But I also think the challenge is that we did not have a systematic way of going about it. That it's like, other than the sporadic interventions, it was not there. The second challenge is the big challenge of the silence of children. I mean, I think it's basically not having adequate safe spaces and ability to speak up, and how we need to treat them. Like, prior trauma are there, age differences are there, cultural differences are there. So that is something which needs intensive empowerment of the caregivers. And the definition of caregiver, not as the house father. Most of the time, this knowledge is resting with one person. Like UNICEF implements this PSEA, that is Prevention of Sexual Exploitation, Abuse and Harassment policy, with NGOs. And within the sector, it usually is a set of people within an organization who will deal with it, and not down the line. I think this is one big challenge. And I think it's also the challenge of disclosure, and how procedurally, how do we go about disclosure and what happens. And thirdly, I think the challenge of stigma, which is there, which needs to be like, how to deal with these ones is another challenge which is there, which I think by and large, a lot of these challenges have been dealt with in the manual itself, how how to go about some of these things. Thank you. Over.
Very important points that have been brought out in this question. I'm moving on to the next one, and Sony, you go first again. Could you list out any opportunities we can avail of to address these challenges and these gaps? So what solutions do we have to address these problems and these challenges? Sony, then Urvashi, and ma'am.
I think, first of all, right now we have got a schema. You have an intervention. I was with the Caregivers National Network last Sunday. And one of the challenges in preparing themselves for this one, this is one area, the whole thing of disclosure, the whole thing of sexuality, this came up as a key area where they were thinking that there could have been more interventions in CCI. So therefore, this is actually something which is demonstrated, and everyone has said it. And I think we have right now this available with us. That is the first opportunity. The second is that the appetite for this kind of interventions, I can certainly, I've already taken the whole thing and discussed it with the Secretary Andhra Pradesh for implementing in CCIs, and she's been, and I think the chatbot thing which was mentioned earlier, she was telling me, Sony, we need a chatbot. How can we really get that? I think I have a solution already, can run to her and say, like, let's run with it, let's do it this way, kind. And I think this is the one way of doing it. I think, how do we make this accessible and known to people? I think you need maybe ambassadors of Enfold. I would like to enroll myself as one, who can actually be talking about the whole thing and how we need to move around. Thank you.
All right.
That's really wonderful to hear. Yeah. We have you have always been, I think, ambassador for children, and now we have you as an ally, which we have all these years. But to have you say that upfront now for this program again really brings joy. Yes, Urvashi.
Yeah. Thanks, Arlene and Sony. I think something which I've been thinking of is over the years, I think specifically after COVID, there has been an increased conversation around mental health. There has been an increased conversation, specifically if you look at the data, the way the reporting has increased. These are trends which also makes us question why the children are coming in contact with the system, whether these children are in conflict with the law or whether these are children who have been sexually harmed. So it is with that, I think we need to make sure that these are the areas where we have to have those conversations. And also something which I notice is with Enfold's handbook, there has been a lot of pre-test and those questions which were done. There were, I think, almost 8 rounds of those, which was absolutely rigorous and beautiful. And with that, we have the data of how, if there is pre-test and post-test, there is, of course, that difference which you see in children. And in our personal work also, we have noticed whenever we have done these workshops and modules, and we have conducted pre-test and post-test, we have seen an increase in knowledge of these children, whether it's on social emotional learning, whether it's about their personal safety, whether it's about raising their voices and flagging those concerns which they have and asking those difficult questions. So I think this is also a very important aspect where we have the data and we are able to say that this works. And hence there is a need to make sure that all the CCIs have this tool. So yeah, I think I would say that.
Thank you, Urvashi. I'm going to go into our next question, and I'm going to start with you, Urvashi. And you have 3 minutes to answer 3 questions, actually. So can you share from the experience of CSJ, your Counsel to Secure Justice, how have you been able to promote awareness on personal safety and sexuality among children and staff in CCIs? What has worked? And would you perhaps want to paint a picture of a child in, say, a CCI, to imagine what a child in a CCI that has got this right, that does these programs, what would a child feel and think? Someone who's experienced this program. So I know quite a bit, but
I'll try.
Yeah, thank you.
Yeah, I'll try. Okay, so I think firstly, something which has worked with us was when we introduced these restorative practices in institutions in Delhi and Rajasthan. And one of the approaches initially when we started working with children, we realized it also can't be limited to children. So we had trained facilitators on restorative practices going to these homes, these CCIs, both shelter home and observation homes. And they're doing activities with children on different themes, so in a circle, like Enfold has mentioned about the restorative practices. And through those themes, sometimes a lot of other emerging themes came from the children. So what we started doing was we started intervening those in our conversation with children on what conversations they would like to have. And added to that was having conversations with staff in the CCI on these practices, whether they are counselors, if they are house mothers, house fathers who are proactive. So training them on trauma-informed approach, and also how do you even hold a circle? How do you even hold a space for children? So those, I think that is one model which worked very well, because when the training is done with the staff who are actually with the children 24/7, then it has a long-term impact because you're training a whole bunch of cadre there. And then slowly, I think what has also worked with us is having those safe spaces within the CCI. So there was this one CCI I remember where children spoke about space. It was a safe space created by children where they felt that they could just sit there, and anybody who sits there is immediately a sign that they need support, and they themselves nominated individuals who could go and check in with the child. So I think practices like these have to emerge from children. And I think there was this one particular incident which I remember where children specifically mentioned how they did not know what is happening in their cases legally. So there was a session done on POCSO and JJ, briefly explaining them what happens in the case. And the children were empowered to ask those questions. They were told that, you have the right to ask the question when you have the next hearing. And one of the child actually asked the judges that I have no idea what is happening in my case. Please let me know. And from there, that perspective shift is very important. We have had girls who had conversations with their parents who mentioned that they didn't want to get married early. because the parents were constantly insisting and putting a condition that they would only take the child from the CCI once they agreed to get married. And the child said that, I'll make sure that, I can go with you, but only if you make sure that I do not get married early, I want to study. So also empowering children in ensuring that they are talking about their own rights. They are also talking about what their needs are, understanding their own needs. These are very important mechanisms. So I think I just wanted to share some of those examples.
Thank you, Urvashi. I love that concept of, creating a physical safe space where children, even if they don't have the words, that when they go and sit there, then the trusted adults know that, hey, this child needs support. What a beautiful idea. I think we need to do this in our own homes as well for children who may not have that verbal thing. So, Soni, would you like to take maybe 2 minutes? Do you know of any best practices around the world now, anywhere else in the world, where these such programs and knowledge resources are being used?
Thank you, Arlene. I think most probably to really look at what Urvashi was saying. Across the globe, basically what is available has been the life skill centered frameworks, like including UNICEF life skill centered frameworks are available. And experiences of Finland, for example, or collaborative academic, social and emotional learning, which the US has been promoting, where most of these dimensions have been covered, but all these interventions have been educational settings. It is not been in childcare institutions or institutional setting. I think Australia and UK are the ones who have progressed in terms of the personal safety education, which is part of it. And I think we must really congratulate Karnataka education for having included that and taken that bold step in the education department as well. And I think Netherlands, the Rutgers RUTGERS program, which has been a global one, which is used these principles and kind of done a little more than life skills is that one. But I think this has been the most effective one globally. But I think what is the success has been that whatever has been successful on the evaluation has shown that they were age appropriate first, and developmentally staged, which at what stage of development children were, and issue, and right-based, inclusive of gender and diversity. I think this is one thing which needs a lot more of knowledge in India. This came up when in the earlier panel, when the children themselves were talking about this gender dimension. How do we really do that one? And I think, as Urvashi said, one of the most important thing was this was delivered by trained educators or people who were trained to do that. And I think this is one dimension which we need to really make as part of our advocacy. How do we get this as a trained one? And lastly, involvement of families and communities was actually one dimension which made the other global interventions more successful. And I think the experiences in Africa and Brazil and all that is being on similar lines, but there the level of knowledge of children is very different from what we are. The kind of exposures and knowledge is very different from the Indian context. So the global experiences, I don't think would really can be transplanted into India, other than these critical learnings of the child-centeredness, the having trained people, and then how do we link communities and others. Thank you.
Tony, I just want to take a minute to first of all, thank you for those little indicators of things that are happening across the world. But for those of you who may not know, the prevention team at Enfold has started a global coalition to promote and understand comprehensive sexuality education. So there are people from all across the world who are coming in and sharing experience, examples, questions, stories. So I think some of this the team may already be aware of, but if not, prevention team, please take note. And those of you who have not heard of this coalition, please do get in touch with Enfold and get onto the bandwagon of all of us who are committed to take this comprehensive sexuality education to more and more children, institutions, and families. Dr. Sneha, I would like to now ask you, what do you think, ma'am, would it take to ensure that these programs like this and knowledge resources like the one that has just been launched, what do you think it will take to scale these up, ma'am?
First of all, maybe for the first time, we have got a structured approach. Or it was earlier there, but it's a better version now. What we are planning to do is we are trying to implement that in our CCI. We will train our staffs. Then in turn, they will train our students or our children. Basically, we will try to develop a student committee or children committees, children informal groups. Basically, more formal approach we give, children will not accept that. It should be better in an informal way, so that we will develop children informal groups, so that children talk among themselves. They discuss among themselves, discuss these issues among themselves. We have to just impart knowledge. We should allow them to discuss among themselves. So they will come out with the thing. Children now are better, much aware, more proactive. They are ready to speak. We should give them an environment. That's it. So we are planning to develop informal groups among our children. First, basically give them the impart the knowledge and also the strategies. What and all should be employed. This manual is very much comprehensive. It addresses everything in that. First, impart them the knowledge, whatever is there. Then develop informal groups among the children, so that they discuss among themselves, so that one of the leader or anyone will communicate the real issue, or they can put it in the suggestion box, complaint box, anything, so that we will come to know the real issue of the children. They will be able to address their issues. So somewhere comprehensively, along with the basic food, vocational training, education, the third dimension, which has not yet been addressed here so far, the personal skill, life skill development of the children, sexuality development of the children will be addressed here. Thank you.
Thank you, ma'am. Very encouraging to hear that, ma'am, the directorate is going to really invest more time and resources to strengthen these children's groups within CCIs. I think that would be amazing if every superintendent, house mother encourages them, age appropriate. Okay, now the little ones, you come together, and the older ones, you come together. And what are the questions you have? And so if there's a caring adult to support those children to talk among themselves, I think restorative circles has a value when there are people facilitating that. But then children can do this on their own as well, and then share with us the questions that have emerged. So very heartening to hear that you believe that that the directorate may take this initiative. I'm going to move on. We have about 20 minutes more for our panel. And this, moving on to children, we are encouraging children to talk about these issues, in these CCIs. And we are trying to empower them and, help them to feel comfortable to talk about it. But what happens when they actually start talking about it within the CCI? When they actually start telling the caregivers and, the people in charge, let's say another child is, violating their boundaries, or another child is perhaps abusing them, may not even be sexually, maybe physical abuse, maybe verbal abuse, humiliation. So as part of life skills, how would they have the emotional, skills and, the courage and the self-esteem, the confidence to be able to bring these issues up to the people who actually care for them? So do we not need to also focus on strengthening this environment? Exactly what Dr. Sneha just said. Yes, we can create these groups, but we also need to create a supportive environment to enable these kinds of conversations and children to feel safe. So the question really is about strengthening systems to prevent such harms, and therefore these kinds of activities where we're disseminating this knowledge about personal safety, etc. But also the systems that once, if they disclose and if they report, then what happens? So Urvashi, perhaps I would like to start with you. Do you have about 3 minutes? Would you like to share any suggestions you may have in this regard about safeguarding systems and supporting children if they disclose and if they talk about harm and issues, sensitive issues with their caretakers?
Thanks, Arlene. And it's a very tricky question, and it gets tricky inside the CCI for sure. And based on some of the experiences we have, even for personal boundaries, for any theme, something which we realized was that it was so important to work with the staff. Now, when I say staff, not only the counselors, the house mother, house father, probation officers, etc., but also working with the security guards. Because there were times where we noticed that these children, we would often go to these homes, the observation homes, and there was a particular time period, once in a week we would go. And sometimes these security guards, because they saw us doing activities with children and how the children were engaged, they sort of encouraged children, which was so heartening to see that happening itself. So you need to have champions within the CCI as well to speak and to encourage children to participate. And then what we also realized that there was a need for the staff to have a safe space as well to have conversations because of the challenges they go through in their daily lives. Because they would often, I remember there was this one time when we were doing activities with the staff in the observation home, and they were so happy and thrilled that somebody thought of them. Because all the organizations or people who came in the CCI, they would do activities mostly with the children. They would not think of the staff and what they were going through. So equally important that we are working with the staff. We are talking about their mental health. We are talking about their coping mechanisms. How are we equipping them? What skills do they need? And this is something which worked very well in Rajasthan as well, where we did a sort of a need assessment with the staff to understand what are the different skills they would like to have in their jobs. And there were a lot of things came up. There were a lot of requests from counselors. They wanted the skills to be upgraded of how to actually be trauma informed. It is not just about having a session, but what are do's and don'ts? What are the practical tools? How do you implement them? So how are we equipping each and every staff member on that? And we have had instances where I think there were times when the child spoke about causing harm to themselves. And in the CCI, it becomes a space where the other children in the same dormitory, they know of it and they bring up the issue also because they know that we trust these individuals. But having said that, sometimes it can backfire. So also working with the staff equally to make sure that there is a space where the children are able to speak about it very freely. And that comes only with constant trainings and constant support to the CCI staff. And I think it's not something which happens in a one-off training because we have seen a change in the environment in the CCI once we have worked with them for over a year at least, where we have spoken to them that it's okay for children to just bring up these concerns, be vulnerable, speak about it in front of the peers, and also be vulnerable to the adults and reach out to them. And what should they do? So, having said that, there is also a huge gap in safeguarding policy. Even in the CCI, despite so many laws being in place. So that is something which we have to very consciously look at and make sure that we are integrating them as well. So that is a space which requires both having conversations with the children, with the adults as well. And, the children's committee can also be such a beautiful space. I remember when children were sitting and conducting these children meetings themselves, they were able to speak about the needs. And they were able to do that in front of the adults. And they were in front of these counselors, in front of these probation officers, and for them to sort of also see that, okay, it's okay to bring up these concerns, So for us to have those spaces is very important. For the home to have that space where the children can express and reach out to organization and do linkages. Why not? There is, so that space needs to be sort of provided. Thanks.
Thank you, Urvashi. I'm going to move to Soni. Soni, would you have some suggestions, and then we can move to Dr. Sneha? Yeah.
Well, certainly, I think the first thing I would actually say when you're looking at donor agencies or others, see, one of the things which I thought even in Mission Vatsalya, if you put this one as a focused intervention, as an innovative intervention, we might be able to get resources to roll out across the state. And maybe we need to dialogue, that kind of a dialogue on with the different states on that. And secondly, the whole thing about SOP of when children speak up. What happens, because this was yesterday, I was talking with the Secretary WCD in Andhra Pradesh, and she was saying, what most of the time you do not know how to deal with it. There is total confusion when something like this, a child reports pregnant, and then what are the protocols? What needs to be done in case of that? That's something which needs to be there. The second is make sure that there is a budget line for such items in whenever such programs are supported with NGOs or whatever, and these needed funds for this education. I was suggesting this Mission Vatsalya and all that as a possible intervention which can be statewide and therefore very focused would be one of the ways of looking at it. And I think the whole thing about safeguarding policy, basically the CCI safeguarding policy is something which is emerging. I think the last decade we are working with CCIs on these safeguarding policies. There is a certain amount of awareness, but we need to really move forward. And then actually complaint and disclosure mechanisms, like, how do we really deal with disclosure, and how do we ensure trauma informed counseling supports? What are those things that needs to be in place to really make this happen? And I think safeguarding incident reporting, and how do we really make that as the part of the intervention is very critical. And I think we need to distinguish between prevention and response data. Basically, a lot of the prevention and response data get smudged, and therefore we need to be. And at CCI, I think there needs to be these, for example, this material which is given is implemented in its totality. There must be a protocol to make sure that you don't take one session and then leave it, like, have this one. Second is, like, we need to create a culture where children feel safe to speak, which I think is already covered. And also need to get into the code of conduct, safe recruitment area, where we need to look at what Urvashi was talking about, even the security guard, or like, the whole safe recruitment, and how do we look at this as part of it. Over.
Thank you, Sony. I'd just like to underscore, I think, what both of you have been saying. I mean, all institutions, government and NGOs have to have these child protection policies as provided under the POCSO rules. And I hear you saying, Sony, that as a donor organization, I mean, you're, where funds are being disbursed to other partners, when donors also recognize that our partners, when they do this work, they need to have protocols in place, they need to have safeguarding policies in place, because it's just not enough to conduct these programs, use these knowledge resources, and okay, now we've done these 8 modules and now we're going. The environment, as Dr. Sneha K keeps, this environment has to be such that children are ready to receive this information, the staff are ready to receive this information, and then we have a protocol. So I want to tell you that when we conducted these pilots, that we did have an internal protocol. If any form of abuse or anything was brought up, that we would bring it up to the superintendent immediately with the consent of the child, because the child also needs to be supported. Of course, if it's mandatory reporting, so more time was spent after the little sessions that we had to work with children to build that trust and say things that you bring up in these circles. When we're discussing these different modules, we are there to support you to navigate through them. So that was a very important, vital aspect of our delivery of these programs. Thank you for underscoring that point. And also that we need budget. So with that budget note, I'm going to ask Dr. Sneha, ma'am, what do you think needs to be done?
What I feel is, first we have to go for a comprehensive training for our staff and with children together. So actually first we have to spread knowledge. What is this? What is everything? First, knowledge should be spread to both our staff and our children. Like, what is sexuality? What is your body? What is bad touch? Everything. First, we have to go with a comprehensive training, which are planning, which we will try to incorporate in the training schedules for CCI. We should go with the training for our staff along with the children together, so that both of them receive the information together in a common environment. Second thing is, we should allow the children to discuss among themselves. And we should also share our own experiences with the children so that they feel that this is normal. Our staff should, we might have also faced many sexual problems. We might have faced abuse as a children. Till today, we are grown up. We would have not shared with anyone. It may be a small thing. It may be a big thing. We don't know. Some people might have faced small things. Some people might have faced big things. We should be open enough to share that. Our staff should be open enough to share with the children, so that the children will feel that this is normal. We can share it so that we will get some help. Nothing is abnormal, and we are not abnormal. So that we face something, that means that we are not abnormal. Something is wrong with us. No, something is wrong with the society, and we should speak up. That we have to imbibe.
Ma'am, I'm just really moved by your sharing just now. And I'm just wondering that, we must have a training with our staff, just the house mothers perhaps. And when you as the director sit with them and we share, this is what circles are about, ma'am. Restorative circles is about this, that we sit together and share from our own lived experience about these questions, the doubts, the fears. And then when our staff, our caregivers feel comfortable that even the director is sharing stories, these trainers are sharing stories, then perhaps their fears, their inhibitions, the stigma, we did have, in fact, during one of our modules where one of the staff says, you all are talking about, things about the private parts, about not using the words, private parts about these bodies in front of the men. I am very uncomfortable. And she actually walked out. And we had to sit with her and say, this is what it's about. This is a challenge. We understand. So, ma'am, you've raised a very, very important point. And I really hope that, together with, we can collaborate on doing something like this. So we have just about 8 minutes left. So I'm going to have club 2 questions that I had in mind. And one is, how do we sustain it? These kinds of programs, and also to share practical action. So we've already have some practical action that has come up from the director and from Sony as well. And you've given some good ideas, Urvashi. So like a rapid fire round, each one of you about 2 minutes, share a practical action that you in your individual professional capacity and others working in the child protection system could also take to use these knowledge resources and promote programs like this in the next 6 to 12 months. So practical action, rapid fire, 2 minutes each. So I'm going to start with Urvashi.
Oh, wow. Okay. So I think continuing with those, those modules, those workshops which we have been doing in the CCIs, that has been very helpful. And at times, of course, it can be very difficult, but reminding ourselves of the fact that there is a lot of advantage which we see. And specifically, I think something which is striking me with these conversations is having very deliberate conversations also around sexuality, because we have seen very good examples of children actually talking about how they felt okay to share after the conversations happened, and how they could treat, whom they could reach out to in case they didn't feel safe, So having those exercises and continuing those exercises wherever required, and for sure developing and training the CCI staff, and continue doing that, because there's a lot of merit in making sure that these staff, the ones who are constantly there with children, are trained on these aspects. So that is something which we'll be focusing on. Yeah.
Sony, would you go next?
Yeah. Okay. I think I will present the whole module and possible way ahead, including the Mission Vatsalya as an innovative program to 4 states. Karnataka, I don't need to do it. Sneha ma'am is here. She is part of it. But I think I also would suggest that Karnataka has MOUs with a lot of NGOs who are doing things with CCIs, and make sure that they sign up for rolling out this one in wherever they are, and they are able to do this one as part of their intervention, because that's something which would make it sure that this is a state policy, and this one. So I would certainly take this one as a resource material for other interventions of adolescent empowerment programs in AP and Telangana, to make sure that this gets as incorporated into the whole intervention which is happening, and which is reaching to lakhs of children across, and mostly out of school and this one. So make sure that even though they are not CCIs, but use of these resources as this one. So I think that is my commandment. I'll also talk about these 2 Assam and Odisha teams with who they have an inclination to work on something like this. And there is enough, like Rajasthan also, how do we push this one within the state as a priority for UNICEF interventions. Thank you.
That's already in action. Thank you, Sony. Yes, Director, ma'am.
We have been given a very good comprehensive material. We will make best use of it. We will train our staff, our children, and also very advice of Mr. George is well taken. We will take the help of our NGOs who are already working in our CCIs to spread this material and whatever knowledge which they will gain from this material to our children. Then we will try to promote informal groups and everything.
Thank you so much, ma'am. I think this is really wonderful to hear these concrete steps that each one of you have suggested, and already thinking about rolling into action. We've had some wonderful points that have come out through this panel, highlighting that this work needs to start with adults first. And just like we did, we worked with the staff of the CCIs first. we really need to sensitize them. And we have heard that ma'am is already talking about this training, and Sony has also talked about, trying to advocate for budget to be spent, because there's a very clear and strong link between this kind of a program about disseminating knowledge and empowering children how to keep themselves safe, with one of the key standards in child safeguarding, which is prevention of harm, and that too in child care institutions. So there's really important points that were mentioned there, and that these programs have to be integrated into the daily life and routine of these children in these CCI, as well as the staff themselves. It's not to be seen as an activity. The staff need to be able to have these conversations in quiet moments with a child sitting in a corner, not just in terms of lectures, etc. And it needs to be systematic. There needs to be pre-test, post-test done, with really trying to respond to the questions that the children ask, where they are at. Each one, especially in our CCIs, we have children coming from all across different other states, not just from the particular local district. So there are different languages, different life experiences, different kinds of risks and abuse that they have faced. So this need assessment and the systematic nature of this program would really help to meet the needs of these children and accompany them. Also, in terms of this children's groups that was highlighted, it's fantastic to hear that when adolescents can sit together, can they be supported to really, literally they tell secrets to their friends. But can we have safe spaces? Can we support these children in their children's groups and create that environment, supportive, nurturing environment for them to really talk a little bit more openly about these issues and get the help that they need, and in a trauma-informed way. So that point was also highlighted, that it need to understand that some children may have had abusive relationships in the past, physical abuse, various forms of abuse, sexual abuse, etc. And one needs to not judge them. One needs to understand why particular children may be behaving in particular ways and support them in this. We also have spoken about the important role that NGOs can play and the partnership that those who are already working in the CCIs, if we can train them and build that the allyship and partnership with them to build a greater task force, perhaps, of people who can take this knowledge resource in different languages to children in CCIs across perhaps the country. And also to be open enough to share our own experiences. A moving moment where Dr. Sneha said that, we need to be models. We need to be able to talk about these things without shame and guilt to demonstrate that this is what a development is, and each one's life path is different. And therefore, if we can build a culture of really listening to one another, respecting children, listening to them, and helping them to be able to talk about these kinds of issues. I'm really delighted to hear about the work that Sony said that is committing to do, and you, Urvashi, with the wonderful insights that you've given from the work you have done in Counsel to Secure Justice. I think that gives all of us hope that this is something that is so important. It is, we have to start doing something differently starting today. How can we use our power and resources in whatever way that we can to positively impact the lives of these young children who are in custodial care? Most of these children cannot go to regular schools. Maybe in some districts they do, but in many CCIs, they don't go out and meet with other children, other teachers, care. They're really stuck in these institutions. So it's really a huge clarion call for us to take up this very important issue. I'd like to close now and thank each one of you, Dr. Sneha, Sony, and Urvashi, for being part of this very, very important conversation and for your continued commitment and passion for children. It's very evident during this panel discussion. I will now open the session for questions from the audience and request our MC Kavita to kindly read out any questions that come up in the chat. So we have an open house now for about half an hour, 45 minutes. Are there any questions that have come up in the chat?
Yes, Arlene.
Yeah.
Leena Prasad has asked, can we look at care leavers as ambassadors, becoming trainers and resource persons for CCIs? The NCLN platform that Sony highlighted could be strategically leveraged to take this model to scale across the country.
Wow, Leena, I don't think that's a question. That's like a plan. Sounds like a plan. And I don't think anyone will disagree with that. What a wonderful suggestion, Leena. Thank you for initiating. I hope in your capacity will be able to initiate it. Udayan Care has played such an important role. So Would anyone else like to respond? So, because I don't think that's a question. Lena, would you like to say, maybe open up, and would you like to share about why you think this could happen and how it could happen? What the NCLN platform is about, perhaps? Lena?
If Lena is not there, I was with the NCLN on last Sunday. We were discussing this as care levers, as champions, not only in care reform in CCIs, but even in promoting ideas like adoption, foster care, where even some of them had already adopted and fostered children, and creating a continuum of support which becomes available as a continuum resource, the care levers as a resource available on these areas. And this was one of those things which they had opened up, being open to doing something like that. Over.
Fantastic. That's really brilliant. It sounds like, aside from children's groups within the CCIs, we have the NCLN platform of care levers who can now be perhaps trained in this, and they become ambassadors. And I think that's such a beautiful idea because they're similar in age. They've been through the CCIs themselves. What a wonderful idea. Thank you, Lena, for that, and Sony for your passion for the same. Yes, Kavita,
Yes,
the next
Arvind,
question.
there are no questions. There are more suggestions. Shall I read them out?
Please do.
Yeah. Please share meeting/discussion and important key takeaways for better understanding and implement in CCI. Finding time to share our own knowledge with children without affecting their routine is difficult. Firstly, need enrichment activities and refreshing training for CCI staff members in the specific topics like child development and parenting skills, sexual education, and life skills education. This has been asked by Sandhya.
Okay, so would anyone to Sandhya's observation about finding time to share our own knowledge with children without affecting their routine is difficult?
I do not agree with this because there is some certain routine for everyone, but we do have time to speak to our family. Children are our family in CCA. We do sit with our family, no? In evenings, in morning. We talk to them. We talk to our children. So same is our children in CCI. CCI staff should sit with them. They should share everything just in an informal way. We don't need any formal sessions or anything. Just in an informal way. Definitely, if we want time, we can have time. We just have to have the intention.
Absolutely, ma'am. Urvashi or Sonia, would you like to respond?
I think it's very well said, and having those spaces, those safe spaces for children is very important. And something which we worked with children in CCIs, I remember, which worked very well was if they came up with values and they put those values on their boards at their respective homes, something for them to look at, but also for the staff to sit with them and slowly work with them on those values. So I think it's a space where equally they need to be sitting with the children, hearing them, and it works very well if the staff is also simultaneously getting trained. So, because in a circle process, for example, when we do the facilitation, the facilitator always shares first. So, when we were also doing handholding support for these counselors who were trained and some of the staff members who were trained in CCI, they, in fact, I remember they would share, and they saw a huge difference in the way the children started communicating with them after the training, and how the language had changed of how they would even address children. And in one of the CCIs, I remember initially when we had not started working with the staff would actually address children with the sections. Children would each other, they would address each other through the sections. But over a period of 8 months, that stopped. And that happened because we were working simultaneously with the staff, we were working with the children constantly, that, you may have done something, but at the same time, that does not define you. So having those safe spaces is very important for them to share about their learnings, to share about their emotions, and how do you deal with them also. So making those spaces is important, and perhaps it can just be a very informal space where I think ma'am was mentioning, or something which is there that every week people sit together. And sometimes I think it's really helpful with the JGB members or the magistrates, they come and interact with children, because then children feel that they are still valued. There are times when children have performed theater, they have performed plays, and they have been encouraged, and they have received certification where it is felt that, the children at least have much more value, and they are not just limited to this, that they are capable of doing much more. So I think there is a lot of value in making sure that, children and staff sort of sit together and have those conversations, but in a way which is very safe for the children to bring up issues.
Okay, maybe just one point. I think one of our learnings from doing this mental health support for caregivers is one dimension where a lot of the challenges which are there with the caregivers we need to address along with the intervention. So that becomes part and parcel. Another thing which I thought is a very important meat is to have one of the caregivers have dinner or lunch with the children themselves. What is actually that breaking those barriers and making it accessible and informal accessible situations is equally important in terms of behaviors that demonstrate much more approachability, because it's like, we are used to behaviors which are authoritarian, and therefore how do we really the whole restorative circle values, how do our caregivers practice that in within a situation becomes equally important. So I think that's also one way of looking at it. Thank you.
Thank you so much. I dropped off for a bit, but just like to reiterate, I think maybe from my point of view, what is the routine? And this is exactly the point that has been made out right from the beginning, that this content, these conversations, these attitudes to be open to these kinds of difficult questions, these kind of questions could be had when children are watching TV, when children are having lunch, when children are playing, carom. So the routine need not or should not be more important than the child at any moment. And I think that culture of being child-centered rather than rules and regulations, that I think is a key shift that all our CCIs need to, and then maybe our DCPOs also need to be more sensitive to that. You can have the routine stuck up on the little timetable on the wall, and maybe you can, so everyone needs to know that these are actually life-changing conversations that can happen and must be prioritized even if the routine is not followed. So that priority for children and their needs needs to be underscored. So thank you for your responses. Is there any other question, Kavita?
Yes, Arlene. There is doubt in parents that if sexuality is spoken about to them, it creates curiosity in children. So how can that be handled? So parents are hesitant to speak about sexuality.
Yes, and this is what Sony said, that in some countries that the parents are also brought into these kinds of conversations. I'm really enthused by the thought that imagine, where the safe parents, the parents who are found to be having positive relationships with these children, to have parents groups as well. But what are the thoughts of any of you from the panelists? Would any of you like to respond? Because once they go back, they're going back to same situations. Yeah.
In fact, I just wanted to narrate one of the experiences where we conducted a workshop for children on consent and understanding their boundaries. And children were initially hesitant, but slowly when one or two started asking questions, raising, what are the boundaries, and these were questions which had also come up in circles. There was a lot of curiosity, and as a follow-up to the workshop, there were some children who sat with the counselor and asked so many questions they had doubts about regarding sexuality. And these were the questions they said they had all the incorrect answers just because based on some random sources or because of what they had learned from their peers. And for us, that was such an important moment that, for children to have that space where they could ask without hesitation, without being judged, then what do we do about these situations? What are the myths around sexuality? So having those open conversations actually help children much more rather than anything else. Because that curiosity needs to be addressed. There are children, there are girls who have reached out to us who are in homes and some places and some homes where it is restricted. It's often said that, if you have conversations around sexuality, these girls, they are going out of the CCI, they'll interact with boys and something will happen. And like, you need to speak to them. Even more important reason that you need to speak to children about it. And for us, we saw a difference when these conversations were happening. The children at least were not going to the incorrect sources. The children at least felt it was not a taboo, because then we are also what we are telling the children, that if something happens to them, it is a taboo, it is a stigma, and they should not disclose. So it is a linked cycle. So we need to understand that, because the minute we do not address these questions from children, it has an impact on how they are perceiving sexuality also, and how in the future that will have an impact as well. So that is something just based on some of our experiences, and having conversations with children has been very helpful. Yeah.
Yeah, and also whether we talk about these things or not, children will have these questions. And yeah, as ma'am rightly said, if they do not get an answer, definitely they will find for other sources, either with their peers or friends, or go to internet. Yeah.
And the other sources may not be safe.
Safe, yeah.
They may be put to abuse.
So talking about these things may
When-
give them
when
an
we speak,
agency. Yeah. So,
Children
yes.
are informed, they are comfortable. They may not go to other sources, which may not be safe, which may lead to much abuse later on. We should also inform children about this thing also, that you should not go into other sources where you may be put into abuse, you may be misused. All this discussion should be open with the children.
Very important point, ma'am. Thank you for that. Is there anyone else who would like to ask a question?
I just wanted to say, like every OD process start where the shoe bites. Basically, most of the childcare institutions, residential institutions have a problem of an early pregnancy getting reported, or children go back on holidays, come back pregnant, or something like this. And how do you use that one to bring parents, do this education, do this talking, and do what is happening around as a means of buying in their collaboration to an effort like this. So it is like, I've seen it in Andhra and Telangana that this was used as a trigger point where they had to deal with the problem, and that I think is one way of and then it becomes much more easier for the system to kind of on an ongoing basis do this interaction with parents and children and kind of have these discussions over.
Thank you, Sony. I am just wondering if there's another perspective, and that, yes, where the shoe bites, and if there's a problem, we respond to that problem. But I think that then it's a reactive thing, and then there's a little negative energy. I really think this should be ongoing. It should be positive. It should be that this is part of life. And, we can talk about our bodies just like we talk about what food you ate today. It should become normal to talk about our bodies, which is there's no shame. There's no guilt. We should be able to have the confidence to have these conversations on an everyday basis. So I think both things work. Thank you for that suggestion, Sony. Any other questions, observations, Kavita, or
Yes.
anyone else would like to unmute
Yes,
and talk? Yeah, go ahead.
We'll finish. There are two more questions. How do we ensure that safeguarding is practiced with integrity, not just compliance, especially when it involves difficulty or discomfort?
Sony, would you like to jump in there?
I don't think I think that's a reality, and I think it is like what I always tell people is a practice, a behavior practice to a value change is from practice. You see what is happening, and then and many a times you might do something because there is a legal requirement or a requirement, but then once you start seeing the benefits, naturally the transition happens. And I think it is not one or the other. It is like, because this is a mandatory behavior pattern, there needs to be a certain level of agreement and this one. But however, this from behavior to attitude it's a natural transition most of the times.
Urvashi or ma'am, I think the question is how we are supposed to have these child protection policies as mandated under the POCSO rules. So the question is, how do we really make these policies? First of all, make good policies, and then ensure that these child protection policies are implemented with integrity, make them part of our culture, our way of life. Would any of you like to add to that?
I think something which has worked is when there are practical experiences or role plays happening or simulation activities happening. And we have seen that actually works very well, even with the duty bearers, to understand the importance of these policies, the child protection policy. And it's not just something which one has to be mandated, but what are the repercussions once you understand them? And if you were in the shoes, what would you do? So to be, and I think we have done those simulations, and it has stayed with them so much because they felt that was a time they felt that as children they were not heard, and for them a realization that as duty bearers it is for them so important to listen to the child when they are actually speaking, to have those conversations, to allow spaces for those conversations. And for us, I think it is also constantly speaking about it, and that behavioral shift will come slowly. It takes time, but to constantly have those conversations and constantly emphasize. And perhaps there are more innovative ways of doing these activities. There are now a lot of use of AI. Perhaps some simulation activities can be developed through that as well. So I think there is a need to integrate and make it more comprehensive, and make it perhaps in a very simple manner as well. How do you implement it? Because it's not just about implementation. I think something which we have faced is that if there is a disclosure, which is what was spoken about earlier as well, how do you respond? And there has been constant concerns, whether you speak about it in CCIs, whether you speak about it in schools, and there are workshops done, a series of workshops done, but there's constant hesitation that what do you do, how do you support the child, what is step one, what is step two. So having those conversations, and specifically around this area of how do you deal with the child and how do you work with the child when there is some disclosure, and also how do you prevent it, because that is something which we have to work towards as well. So it has to be a bit holistic rather than just sticking to those policies, and also asking children, what do they think would be the best ways? Because we often think of these policies, but we forget children. So can we ask children themselves, what are the ways where they think they would like to these policies to be implemented? Do they have some ideas? Perhaps they do. So also asking those very important stakeholders, which are children.
Thank you, both of you, for that. Ma'am, would you have any suggestion in response to this question? How do we make child protection policies come alive and be a living document?
What I feel is, rather than sticking to just a theoretical lectures or something trainings, we should come out with more of a practical things, some movies which are promoting this, some something what is there which children are much interested these days is reels, some reels which will come out with this, some life experiences, people who talk about that. More of informal things will help children to imbibe these things, especially in schools. More of a dance, drama types. We should encourage all these cultural activities types. More of a theoretical, people will study, may concentrate for 10 minutes, they will forget. But some of the practical implementations will make the children remember that, especially making children part of that, to enact that, to know that. Involving school, maybe education department is a primary thing in this, I feel.
Thank you so much. I think this is, again, I'd like to link it back to, the prevention, the standard on prevention in child protection policies. So I was just wondering that, ma'am, I think you also mentioned earlier that you'd like to ensure that all the staff are trained in this And I'm just wondering, because in safeguarding, things like this need to be part of their very induction. So sometimes there are staff coming in from the ICDS wing and jumping into the ICPS or the child protection with little or no understanding of, and I really empathize with those staff, because then, they don't know how to handle these situations. So I think if this is a non-negotiable, it becomes part of their induction program. And then when they are asked to sign this code of conduct and this declaration of commitment that they're going to keep children safe, they're going to respond to questions, and make an effort to get over their own inhibitions to talk about, issues related to personal safety, to make a commitment to that they are not going to discriminate against children of different genders, not going to discriminate against children who have an intellectual disability or children from a different caste.
I agree with that, because in ICPS, children are more into need of safety, and these are the children, they have gone through something in their life. And it is not just like we will provide them Anganwadi, we'll provide them food, we'll provide them additional nutrition. We can't handle only with that. We need proper training and attitude, separate attitude set up for that.
100%, ma'am. So you hit the nail on the head, the attitude training, So I think these pre-tests that we do, the questions that we do for things, perhaps that needs to be done at the time of induction. Look, what do you think about different genders? What do you think about sexuality? And use that opportunities to accompany the staff first, because as was repeatedly said during this conversation, that we adults need more work on ourselves first before we can, so I think that becomes an investment. Then these policies, that prevention and the response as well. So if a child does bring up an abuse or does bring up a suggestion, perhaps that, something needs to be changed, that we are more open, that we are more able to talk about this with using the restorative circle approach. So, perhaps restorative circles training needs to be done of what does it mean to sit with the children, not be the teacher, but be a human being with them and tell them stories from your own life and say it's okay to talk about these things. And it's, I'm really sad that this has happened to you. What can we do to support you? To how to enable staff to move away from routine, move away from file. I know they need to deal with their files. They need to deal with their issues. That is part of their job. But what support do the staff need? So I really do think that staff need to, I think at some points, we have taken staff away from the CCIs and they just love to come for a different program, and then when they're able to talk about their challenges and concerns.
Yeah, I think Lynn is facing electricity issues at office. Yeah, she's back.
Very unstable. So Lata, would you like to do the, is there anybody, I think there's one more question.
Yes, Arlene, there's just last one question. I think it is for you. Sunita Gaikwad has asked, after reading the handbooks released today, if there are questions, who is the contact person? And also if there's a WhatsApp group, kindly add me in that.
Yeah, that's so lovely to hear. I think this information can be given to everybody. Lata, what would you suggest?
Yes,
people can write to
definitely.
info at Enfold?
Yeah, they can write to info at Enfold, and creating a WhatsApp group is a great idea that we can take it forward. Yeah. Sunita, if you are here, please write your questions to info@enfold.org, and that will be forwarded to either Arlene or me or any one of us here, and we will be able to answer your questions.
I would like to also, I hope you can hear me, my internet is off, but to also, Lata, somebody from the team, can you please post a little bit about the Comprehensive Sexuality Education Coalition, so there are people who may be interested to join the coalition. And there's so much more resources there and a global community for us. So this WhatsApp group is great, but there's a global community that awaits you as well. So somebody can please post that on the chat for others to join in.
You can put the link. I can also give this information. If you go to our website, there is a section for Global Coalition events, which happens every quarter, and we will be announcing it priorly, like what are the topics that we are going to discuss and who can be the panelists and everything. Please join those coalition meetings, and you can also be part of those coalition. You can join through the link that is there for registration.
Yeah. Now, Lata, I'm going to invite you to please speak in Kannada for some of our Kannada participants and close this webinar. So please put the Kannada hat on, because we have a number of people from Karnataka. Thank you so much.
Yes, thank you, Aline. ಆಕ್ಚುಲಿ ಇಲ್ಲಿ ಕೆಲವರು ಕೇಳಿದ್ದಾರೆ, ನಮ್ಗೆ ಇನ್ನೂ ಹೆಚ್ಚು ಪ್ರಶ್ನೆಗಳಿದ್ರೆ ಅಥವಾ ಸಂದೇಹಗಳಿದ್ರೆ ಯಾರನ್ನ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಬೇಕು, ಹೇಗೆ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿ. ಸೊ ಎನ್ಫೋಲ್ಡ್ ನಮ್ಮಲ್ಲಿ ಒಂದು ಇಮೇಲ್ ಐಡಿ ಇದೆ, info@enfold.org. ಕವಿತಾ, ಇಫ್ ಯು ಕ್ಯಾನ್ ಪುಟ್ ಇಟ್ ಇನ್ ಚಾಟ್ ಅಲ್ಲಿ ಬರೀತಾರೆ, ಅಲ್ಲಿಗೆ ನೀವು ನಿಮ್ಮ ಪ್ರಶ್ನೆಗಳನ್ನ ಕಳಿಸ್ಕೊಡ್ಬೋದು. ಅದನ್ನ ನಾವು ಇಲ್ಲಿ ಅಲಿನ್ ಟೀಮ್ ಅಲ್ಲಿ ಇರ್ಬೋದು ಅಥವಾ ನನ್ನ ಟೀಮ್ ಅಲ್ಲಿ ಇರಬಹುದು, ನಾನಾಗಿರ್ಬೋದು, ಯಾರಾದ್ರೂ ಅದನ್ನ ಆನ್ಸರ್ ಮಾಡಿ ನಿಮ್ಗೆ ವಾಪಸ್ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತೇವೆ. ಅದ್ರ ಜೊತೆಗೆ ಇನ್ನೂ ಒಂದು ಪ್ರಶ್ನೆ ಕೇಳಿದರೆ, ವಾಟ್ಸಪ್ ಗ್ರೂಪ್ ಏನಾದ್ರೂ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗುತ್ತಾ ಅಂತ ಹೇಳಿ. ಖಂಡಿತವಾಗಿ ವಾಟ್ಸಪ್ ಗ್ರೂಪ್ ಕ್ರಿಯೇಟ್ ಮಾಡಬಹುದು. ಅಲ್ಲಿ ಕೂಡ ನಾವು ಸಾಕಷ್ಟು ವಿಚಾರಗಳನ್ನ ವಿನಿಮಯ ಮಾಡ್ಕೋಬಹುದು. ಇದರ ಜೊತೆಗೆ ಇನ್ನೊಂದು ಇನ್ಫಾರ್ಮೇಶನ್ ಕೊಡಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಎನ್ಫೋಲ್ಡ್ ನಲ್ಲಿ ಒಂದು ಗ್ಲೋಬಲ್ ಕೊಯ್ಲೇಷನ್ ಅಂತ ಒಂದು ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಇದೆ. ಅದರಲ್ಲಿ ನಾವು ಏನಂತ ಹೇಳಿದ್ರೆ, ಈ ಕಾಂಪ್ರಹೆನ್ಸಿವ್ ಸೆಕ್ಷುಯಾಲಿಟಿ ಅಂದ್ರೆ ಲೈಂಗಿಕತೆ ಮತ್ತೆ ಪರ್ಸನಲ್ ಸೇಫ್ಟಿ, ಜೆಂಡರ್, ವೈಯಕ್ತಿಕ ಸುರಕ್ಷತೆ ಮತ್ತು ಲಿಂಗತ್ವ, ಇದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತ ಎಲ್ಲ ವಿಚಾರಗಳನ್ನ ವಿವಿಧ ವೇದಿಕೆಗಳಲ್ಲಿ ಚರ್ಚೆ ಮಾಡ್ತಿರ್ತೀವಿ. ಇದೇ ತರ ಪ್ಯಾನಲ್ ಡಿಸ್ಕಷನ್ಸ್ ನಡೀತಾ ಇರುತ್ತೆ. ಸೊ ಆ ಗ್ಲೋಬಲ್ ಕೊಯ್ಲೇಷನ್ ಗ್ರೂಪ್ಗೆ ಕೂಡ ನೀವು ಜಾಯ್ನ್ ಆಗಿ ಮೆಂಬರ್ ಆಗ್ಬೋದು. ನಮ್ಮ ವೆಬ್ಸೈಟ್ಗೆ ಹೋದ್ರೆ ಅದರಲ್ಲಿ ಗ್ಲೋಬಲ್ ಕೊಯ್ಲೇಷನ್ ಟ್ಯಾಬ್ ಅಡಿಯಲ್ಲಿ ರಿಜಿಸ್ಟ್ರೇಷನ್ ಲಿಂಕ್ ಕೂಡ ಇರುತ್ತೆ. ದಯವಿಟ್ಟು ಈ ಒಂದು ಲಿಂಕ್ಗೆ ಜಾಯ್ನ್ ಆಗಿ ಅದರಲ್ಲಿ ಮುಂದೆ ಬರುವಂತಹ ಈವೆಂಟ್ಸ್ ಗಳ ಬಗ್ಗೆ ಅಲ್ಲಿ ಮಾಹಿತಿ ಇರುತ್ತೆ, ನೀವು ಅದರಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಬಹುದು.
Thank you, Lata. And just two more sentences more that I would like to say as we draw to the close. First of all, thank you, Dr. Sneha, for really sparing your time, preparing. You went through the handbooks and you've engaged so closely with the content and this conversation. Deeply appreciated, ma'am, and inspired by your leadership and commitment and the sharing of the suggestions that you've had, wonderful suggestions. We do believe that our Enfold partnership with the Directorate, we have an MOU with you. Looking forward to extending that and perhaps bringing in much more activities through which this particular knowledge resource can be taken to more and more staff and children across the state. Thank you, Soni, for your, as always, passionate, enthusiastic response and your offers to, suggestions and motivation for us to keep children at the center. Thank you so much, Soni. Deeply appreciated. And Urvashi, thank you for the lovely stories you shared and the examples that you've given. We know the wonderful work that you all are doing using circles and CCIs and conversations around this. So wonderful to have allies and partners like you. I would also like to thank Ms. Shilpa Diazar, CSR head from BOSCH-BGSW CSR initiatives. We've really enjoyed a 3-year partnership with BOSCH, which really gave us, it was a small partnership, but it was a great relationship through which we did some wonderful work, including the work of developing these handbooks and conducting these sessions. We do need CSR, more CSR partners. So if life skills and personal safety must move from the margins to the core of institutional care for children in need of care and protection in India, we need all of us to come together. And for that, all of you participants who have also been so participative and the questions and suggestions you have given, it's been a wonderful morning. Please do share these knowledge resources with people you know and ask them to get in touch with us. With that, I'd like to thank each and every one of you, and let's continue working together to change attitudes, to shed the shame about talking about our bodies, to grow in confidence and love for children, that we can work through the challenges that we face in CCIs and make this available for more and more children and perhaps even their families by working very closely and collaboratively with the staff in these CCIs. So with that, thank you everyone for being part of this conversation.
Thank you.
Thank you. Thank you for a well-conducted
We should have a group photograph if there's
Thank
consent.
you. Yeah, we can have a group photo. Please turn on your videos.
Absolutely. So I'll just take off the pins and then we can, yeah. Can somebody help with removing this pin? Can somebody remove? We'd love to have you, Urvashi, but I think we need more space for the others. I don't know how to remove this pin.
I think for me, it's done. It shows the gallery. I'm not sure if it's still showing the
fine.
I think
picture.
it's
Yeah,
the speaker mode maybe on or something like that. The speaker
Yeah.
pinning.
So Arlene, it might be for you. We are able to see everyone. Yeah.
Okay.
But now you see, whoever is speaking is coming on.
We
Hepzibah, you came on
don't
second time.
Don't speak, don't breathe. Who's taking the picture?
I'm taking it. It's done. I have taken it.
Thank you.
Okay.
Thank
Thank
you,
you.
everyone.
Thank you,
Thank you,
everyone.
thank you
everyone.
so much. Thank you so
Thank you,
Well
much.
done.
everyone.
And
Thank you.
Beautiful. All the
congratulations,
very
Enfold,
best.
once again. Thank you. Bye-bye.
Thank you.
You can stop the
we
recording.
can end. Yes.